You are about to undergo surgery prior to anesthesia. The surgeon hands you a leather strap to bite down on and tells you to think of your happy place. There's no countdown, no IV, no sweet descent into sleep, just a shot of whiskey, a saw, and hopefully a fast doctor. If you had the misfortune of being alive pre-anesthesia, this was your surgery. Then came the 1800s, an era where pain relief went from party trick to medical miracle. Ether, chloroform, and even support from a certain royal queen changed everything. But not without a few explosions, overdoses, and moral outrage, of course. Before anesthesia, surgery was all about one thing: speed. The faster a surgeon could saw through a limb, the better your odds of surviving. Not just the pain, but the blood loss, infection, and shock. If your doctor was slow, you didn't need to worry about healing. You'd already be dead. Surgeons were trained to amputate a leg within minutes. Robert Liston could do it in about 90 seconds, and his record was 28. He was famous for being the fastest leg hacker. He even had a motto: "Time me, gentlemen." And they did. He once performed an amputation so fast that he accidentally cut off his assistant's fingers and cut a spectator. 3 people died, 2 from infections, and 1 supposedly from fright. It is the only surgery with a 300% mortality rate. In another case, Liston accidentally cut off more than just a leg on one of his male patients. In spite of all that, you'd be lucky to have him as your surgeon back in the 1800s. While most surgeons lost about 1 in 4 patients, Robert Liston lost only 1 in 10 because of his speed. This is what surgery was like before anesthetics. It was brutal and barbaric. Once anesthesia came along, first ether, then chloroform, the entire culture of surgery changed. Surgeons no longer had to race the clock. They could take their time, focus on precision, and stop worrying about their patients flailing or screaming mid-operation. If your doctor was feeling generous, maybe they'd give you some opium or morphine before cutting your leg off. While very effective pain relievers, opiates are not anesthetics. Opium had been used for centuries, but it really hit its stride in the 19th century. Derived from the poppy plant, it was cheap, effective, and found in just about everything, from teething syrups for infants to cough remedies and women's tonics. You could buy it over the counter or by mail order catalog. No prescription required. No warning labels either. Then came morphine, isolated from opium in 1804 by a German pharmacist. Morphine was stronger, more predictable, and quickly became the go-to for battlefield surgeons during the Civil War. Doctors used it liberally to treat wounds, amputations, and internal injuries. Soldiers even carried a morphine kit in their pocket. It dulled the pain all right, and it also created a wave of addiction so common it earned its own nickname, soldier's disease. Still, neither opium nor morphine knocked you out. They sedated you, calmed you, and helped you take the edge off while someone sawed through your femur, but they were almost always awake, sometimes screaming, sometimes singing, sometimes just drooling. These drugs were usually given before or after surgery, not during. Surgeons knew that opiates could ease the pain, but they didn't offer the same control or muscle relaxation as true anesthetics. And dosage? That was more of an educated guess than an exact science. Too little and the patient suffered. Too much and the patient stopped breathing. So while opium and morphine were absolutely essential in 19th century medicine, they weren't miracle drugs. They were the best available option in a world that didn't have any anesthesia yet. but that would change very soon. Nitrous oxide, better known as laughing gas, was discovered in 1772 by English chemist Joseph Priestley, the guy who discovered oxygen and 8 other gases. Priestley wasn't trying to cure pain, he was just experimenting with gases, like any good 18th century scientist with questionable safety standards. He noted that nitrous oxide had a pleasant effect when inhaled. Nitrous was further explored by Humphrey Davy in the late 1790s. Through lots of personal usage, Davy learned that the gas caused laughter, dizziness, and just made you feel good. Probably his most important observation was that it dulled pain. After all of his experimentation for science, Davy suggested that the nitrous oxide could be used for surgery. The idea didn't go anywhere, though. Progress was slow in the 18th century. By the 1820s and 30s, laughing gas parties were all the rage. People would gather to watch volunteers inhale nitrous oxide, laugh uncontrollably, and sometimes fall down. It was like stand-up comedy meets pharmaceutical trials. These parties were advertised in the newspaper, like this one from the Daily Cincinnati Republican in November 1834, selling a tour of the museum and an evening of watching people huff nitrous gas. No one was taking it seriously at first. That was until Horace Wells, a dentist, watched one of the nitrous parties and saw a man hurt his leg without even noticing it. That was Wells' light bulb moment. The next day, Wells tried some laughing gas and had one of his colleagues yank out one of his molars. When he woke up, he exclaimed, "A new era in tooth pulling. It did not hurt as much as the prick of a pin." It was a success. No pain or screaming required. Thrilled with his findings, Wells brought his idea to Boston to show it off to some bigwig surgeons. Unfortunately, it didn't work as well this time. The standard screaming ensued, and Wells' career never did recover. His patient was both an alcoholic and obese. 2 factors that make nitrous less effective. But still, the idea that nitrous oxide could be used for pain relief was born. Horace Wells has a monument for his contributions to anesthesia in Hartford, Connecticut. Just like Wells, William T.G. Morton was obsessed with finding a way to yank teeth without horrifying his patients, or himself. Morton apprenticed under Wells, but he didn't want to mess around with nitrous oxide again, especially after watching Wells' public humiliation. Instead, he turned to diethyl ether, a highly flammable, sweet-smelling solvent known to knock people out cold. Ether had been around for a long time, since the 1500s, but its uses were more recreational than medicinal. People used to throw parties, what they'd call ether frolics, where they would inhale the fumes and try not to set themselves on fire. On October 16, 1846, at the Massachusetts General Hospital, Morton convinced the surgeons to let him demonstrate ether anesthesia on a patient undergoing a neck tumor removal. Morton administered the gas, using a glass inhaler, and amazingly, the patient didn't scream, flinch, or pass out from shock. The surgery went smoothly. The crowd of skeptical doctors was stunned. One surgeon, Dr. Warren, famously turned to the audience and said, "Gentlemen, this is no humbug." And just like that, pain-free surgery became a real possibility. People used to scream in agony while they had limbs cut off. They had to be strapped down just so that the doctor didn't accidentally cut an artery or something important. People were lucky if they passed out from the pain. All of that torture was in the past. Dentists and surgeons excitedly promoted the product in the newspaper. Ether was not perfect, though. It was extremely flammable, irritated the lungs, and caused profuse vomiting. Still, a good trade-off from the alternative. Morton spent his entire life trying to patent his work and get rich off of his discovery. At least history remembers him. You can visit the surgical amphitheater where this groundbreaking operation was performed. It's called the Ether Dome. For the first time, people started walking into surgery without writing a will first. If ether was the enthusiastic intern of 1800's anesthesia, chloroform was the polished, well-dressed replacement. Several different chemists discovered chloroform in 1831. The 1800's famously loved multi-claim patent drama. Chloroform, unlike ether, was non-flammable and was discovered to knock people out cold. In 1847, James Young Simpson decided to try chloroform with his friends. They all passed out on the floor and woke several hours later. Simpson immediately began to use this drug on his patients, laboring mothers. This sparked a lot of backlash, mostly because of religion. It was the belief that pain was divine and required for childbirth. It was virtuous, noble, and maternal. To avoid the pain was to defy God's will. Some doctors and clergy insisted that easing labor pain was sinful, even dangerous. Others worried that anesthesia would make men weak or women morally suspect. Pain was seen as a test of character. Numbing it was practically cheating. There was story after story published in the newspapers talking about the ill effect of chloroform. Tragic deaths, convulsions, and paralysis. How do you silence the naysayers? You get a royal endorsement, of course. Chloroform really began to take off when Queen Victoria decided to use it for the birth of her 8th child. Apparently, 7 painful births was enough. She declared her experience with chloroform birth delightful beyond measure. In a letter she wrote about another new mom, she expressed her feelings about chloroform. Very glad to hear Minnie is going on so well and had had the inestimable blessing of chloroform, which no one can ever be sufficiently grateful for. The Queen's support helped sway public opinion, and thus pain relief for childbirth was born. At least, it was for the middle class and up. If the Queen of England could use pain relief, how sinful could it really be? Chloroform has risks, though. If you took one whiff too many, it could just up and stop your heart. The margin of error was very slim, especially in the 1800's when dosages were kind of like throwing darts. Hopefully you get close. James Simpson, chloroform's biggest champion, called it a blessing from God. Critics, on the other hand, whispered that it was the devil's breath. The truth, as usual, lived somewhere in between. By the end of the 19th century, both ether and chloroform were still in widespread use. Ether in America and chloroform in Britain and Europe. While Americans leaned into ether, despite the vomit and flammability, the British preferred chloroform. Less coughing, more cardiac arrest. Each had its strengths, each had its risks, and both had reshaped the practice of surgery forever. No longer did doctors have to choose between pain and survival. Now, for the first time, you could sleep through your own amputation. Of course, in a lot of surgeries, you really don't have to be asleep. You could take, for example, cocaine, the first local anesthetic. Dr. Carl Kohler came up with the idea of using cocaine for eye surgeries in 1884. Before cocaine, operating on the eye was like trying to carve a marble sculpture. while the marble screamed and flinched the whole time. Cocaine changed that. It numbed the area, kept the patient alert, and was a game changer for delicate procedures. In an article in the New York Times from 1885, the author states, "In operations upon the eye, I now feel that I could not get along without it. In general practice, it has driven ether and chloroform out of the field. It is not only a wonderful discovery, but it is astonishing how rapidly it had risen into favor." Not only was it useful locally, but it was also the first spinal anesthetic used too. In 1898, a German surgeon, Dr. August Bayer, injected cocaine into the area around the spinal cord, and the patient went numb as planned. Of course, in 19th century fashion, Bayer tried it out on himself too. He had his assistant hit his legs with hammers and burn him. He didn't feel a thing. Spinal cocaine was a success, though he did give himself a brutal spinal headache. Cocaine has some serious drawbacks, however. It was wildly addictive, and there were reports of hallucinations, paranoia, violent outbursts, and of course, severe health problems. By the turn of the century, public concern grew. Laws began cracking down on its casual use. But for a brief, glittering moment in medical history, cocaine was seen as the future of medicine. It only took until 1905 to replace cocaine with safer alternatives like Novocaine. The 1800s didn't invent suffering, but they did start to end it. Before anesthesia, surgery was a gamble. You went in awake, alert, and fully aware that you might die, not from the knife, but from the shock of feeling it. Doctors moved fast, not because they were careless, but because they had no other choice. But then came ether, chloroform, and cocaine, and with them, the idea that pain wasn't noble. It was a problem that could be solved. The century that gave us the Civil War carnage and questionable hygiene also gave us sterile instruments, antiseptics, and for the first time in human history, pain-free surgery became a real possibility. The 1800s were messy, painful, and often reckless, but they gave birth to modern medicine, one patient at a time. Sometimes progress looks like a saw, a bottle of ether, and a room full of doctors willing to try something new.